Hello everyone, welcome to my YouTube channel. I'm going to be looking at another question that has to do with erythrocyte sedimentation rate, which we call in short form ESR. So the question goes this way: which condition is associated with an elevated ESR? In other words, what could make ESR to be high? Okay, but remember that this question is from American Society for Clinical Pathology exam, but like I've said, it can also help you when you go for your interviews in biomedical, as a biomedical scientist, or maybe biomedical scientist interview question. Okay, so I hope it's going to help you. But before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So let's look into that. First of all, let's break these three letters or words: erythrocyte sedimentation rate. So when you say erythrocyte, you are talking about red blood cell. Remember, it can be red blood cells or erythrocyte. Okay, so erythrocyte is red blood cells. Okay, now sedimentation is, think about it this way. So if you have a cup of water or a tube of water and you put some gram of salt in it, or put something like sugar inside, some gram of sugar in it, and you mix it very well, okay, and then you allow it to stand, that gram of salt or sugar is going to start settling down at the bottom. Okay, so now even though they were floating when you shake it, okay, or mix it, once you stand it, they will start settling down. Okay, now the rate at which is set down, when it's settled down, that is sedimentation. Okay, now how quickly it fall down or settle down, how quickly those grams of sugar or salt go down at the bottom and stay, is called the rate. Okay, the fast, how fast or how slow, how quickly it was able to settle, that is the rate. Sedimentation is when it has settled. Erythrocyte is a red blood cell. So if we are to bring it in the real context, remember, blood is a whole blood. So in the whole blood, it is divided into two parts. You have the liquid part, and that liquid part is what that helps the blood to circulate. Without the liquid part of the blood cannot circulate, remember? So that is why it is important. So that liquid part is what we call serum or plasma, as the case may be. Okay, now you now have the cell part. On the cell parts, you now have what we call platelet, or you can call it thrombocyte, or you have white blood cells, you can call it leukocyte. Then, or you have red blood cell, or you can call it erythrocyte. So when it comes to ESR, our focus is on what? Red blood cell. Does that make sense? Okay. Now, what it means is that we are going to check that whole blood. Remember, I told you about a glass of cup of water, you put sugar in it or salt in it, as the case may be. The same thing is applicable. So just see the whole blood, the liquid, which is a serum, okay, is like that water. Now the cells, or including the red blood cells, are like the gram of sugar that I've mentioned. So what happens is that when we take a whole blood, okay, and put it in a tube, we allow it to stand. So when we allow it to stand, maybe for 30 minutes or for 1 hour, as the case may be, okay, we allow it to stand. Then we can now measure how quickly the red blood cell is able to sediment. Does that make sense? Okay, so that measurement is what we call ESR, okay, erythrocyte sedimentation rate. Now let me give you a background why I'm saying this, because you need to understand why these things are being requested. Now think about it this way: if the cells are healthy and there are enough cells, okay, if the cells are healthy, there are enough cells, what is going to happen is that the cells are going to pack. If you remember what we call PCV, which is packed cell volume. So the cells are going to pack. And if there is enough cells, even though they are sedimenting, but because there's enough cells, you are going to see that the cells will sediment, obviously, but you're going to see that it will still be, it's not going to sediment quickly because there are no too much space in between them, as the case may be. The red cells are healthy, and because they are healthy and there's enough volume of the red blood cell, they will come together, and because of there are many of them, or there are enough of them, amount of them that is enough, and they are all healthy, they will pack slowly and they will not fall quickly because they are healthy and they are aligned within themselves. And that way, when you measure it, if it is a healthy patient, it's not going to be high because it's going to take time, because the volume is normal, and of course there's red cells, like the shape of the red blood cell is also normal. But if the red cell fall quickly, something is wrong. That means the shape may not be okay, or maybe there is not enough of it, and because there's not enough of it, then it is easy for it to fall. Okay, think about if you put maybe let's say 10 grams of sugar in 5 ml of water, or maybe you put something like 50 grams of sugar in 5 ml of water, think about it. If you mix it, you are going to see that even when you look at the rate at which it will settle, the one that has the less gram will settle faster compared to the one that has the highest gram, or the highest gram. So that is the same thing applicable with the red blood cell. If the red blood cells are normal, the shapes are normal, it's going to take time. And that is why the result will not be high. Okay, it's going to be normal. But when the result is high, it means that something has happened to the red blood cell. It's either that the shapes are not normal, they are not healthy red blood cells, or the volumes are not normal. So in that case, it can fall quickly. So question, what could lead that to happen? So that means the person may be going through some certain kind of condition, maybe disease, or as the case may be. So now this disease, we're going to put it in a general form, which is called inflammation. So inflammation is going to be a bigger umbrella that can accommodate many diseases. Does that make sense? Okay, now let's say something like beta thalassemia, that's a disease. Let's say something like maybe sickle cell disease, that's also a disease that can affect erythrocyte, but they are all under inflammation. Okay, or maybe someone is infected with bacteria, as the case may be, and that has caused inflammation. That will affect the red blood cell as well, and then it can sediment fast. So the answer to the question actually is inflammatory disease or inflammation. Okay, but I have my reason of giving you this point because I want to tell you all the options given. Okay, so we're going to go through it again. Let me go again. Which condition is associated with an elevated ESR? That means the ESR is high. A, they say polycythemia vera. B, congestive heart valve. C, inflammatory disease like temporal arthritis. You already know the answer because I mentioned it. That's the answer. Then D, they say sickle cell disease. So now the reason why I gave you that background information is that you could see sickle cell disease. In a sickle cell disease, you should expect erythrocyte to be high. It's going to sediment. The cells are not healthy, and there's a possibility that maybe the red blood cells may not even be normal. Okay, so there may not be much of it, or if there is much of it, they are not normal. Okay, in shape, and that can somehow affect the erythrocyte, and it can also lead that to to fall quickly, as the case may be. Okay, or maybe severe anemia, or as the case may be. Okay, but mainly inflammatory disease. So inflammation is a big umbrella that accommodates other conditions that could also lead to high erythrocyte sedimentation rate. That was why I mentioned it. Okay, so let's go through the options. A, polycythemia vera. No, it is not polycythemia. Now, first of all, what is polycythemia? Poly means, you say poly, it means that it is high. When you say hypo, it means that it is low. Okay, now polycythemia. So we are breaking the word. Poly means high, Cy means cell, themia means red blood cells. Okay, so polycythemia means red blood cell that is high. The volume of the red blood cell is what? High. That in itself that is unlikely that will make erythrocyte to be high. Do you know why? There's already too much more than enough red blood cells in the sample. So because of that, they are going to pack. Do you get the point? Okay, that will not lead to high erythrocyte. That was why I mentioned to you that. So with the polycythemia, the volume is not just normal, it's more than normal. It is abnormally high, and that way, the cells, even when they sediment, there's so much cell that can make it not to fall quickly to the bottom because there is so much cell. So it cannot be polycythemia vera. Okay, now congestive heart valve. I think for me to explain this as well, I need to explain polycythemia vera. So if there is too much red blood cell, remember, in our body, it is important that everything maintain the normal targeted range. That's why we have what we call reference range, and some people call it normal range. Okay, so now that reference range is what is supposed to be. Anything that is lower than the reference range is not normal. Anything that is higher is not advisable. Okay, so what has happened that we want normal red blood cell. We want red blood cell to be normal in our system, but we don't want it to be too high, because if it is too high, there's going to be too much red blood cells, and that too much red blood cell will mean that there will not be much space in between the red blood cell for them to float around. Does that make sense? And what it means that if the red blood cells are not able to float around the way they're supposed to, they will start forming agglutination. They will start, forming aggregate between themselves, because they are coming together, and that can cause thickening of the cells, okay? And that thickening of the cell can now lead to the risk of what? Blood clot, red cell clotting in the system. Do you get the point now? Because the red cells are abnormally high, there is no more space for the red cell to float, then it will begin to cause thickening because the cells are beginning to aggregate or form a kind of villus formation, okay? And that can lead to clot formation. And that, once there is a clot formation in the system, that can block the blood vessel. And once it blocks the blood vessel, the blood cannot flow the way it's supposed to be, and that can now lead to what we call congestive heart failure. So I'm trying to say that it is not polycythemia, it is not congestive heart failure, but I wanted to link that all together for you, okay? Now, C is inflammatory disease like temporary arthritis. Like I've said, that is a correct answer. Inflammatory disease or inflammation is the reason why there can be high rates of erythrocyte sedimentation. Does that make sense? So it will be high. Now, it cannot be sickle cell, like I've mentioned to you, is a disease. So D is sickle cell disease. Now, we are not going to choose, because this is options, okay? If they say choose two likely options, I will also choose sickle cell disease. Does that make sense, okay? Now, or it can even be any of this, to be honest, okay? Because if there is a clotting in the system, that means the red cell volume is going to be low now, and that can lead to the high erythrocyte sedimentation rate. But it's not sickle cell disease, because all of these diseases, may be under inflammatory disease. So the answer is inflammatory disease. I'm only going this route just to show us that there are a number of factors under inflammation that can lead to high erythrocyte sedimentation rate. Like I've said, if there is polycythemia vera causing blood clotting in the system, the volume of the red cells is going to be low. Now, like I mentioned, sickle cell disease means that the sickle cells, the cells are not normal, the red cells are not healthy, okay? But however, all of these things are under inflammatory disease. So anytime you go for interview, they said, what can cause high erythrocyte sedimentation rate? That is what? Inflammatory disease. So inflammatory disease is the right answer. Can I also mention here quickly that during the inflammation, now the red cells are going, the ESR is going to be high, is going to increase, and that increase due to inflammation will cause release of fibrinogen. Remember what I taught you about polycythemia, because the red cells are now coming together, aggregating, and that aggregating can activate clots. That means it can then activate, fibrinogen. So, but what happens is that if there is inflammation, there is a release of fibrinogen, okay? Now, that release of fibrinogen is what that can lead to the red cell to form villus formation, or basically form aggregation or begin to form clot. So in erythrocyte sedimentation rate being high, in other words, in inflammation, I want you to also know that fibrinogen can also be released, okay? And that way you can see how all these things link to what? Inflammatory disease. But all of them, they are under inflammation. So erythrocyte being high, what can cause it? Inflammatory disease. But don't lose your eyes on the possibility of the polycythemia leading to that, and the possibility of congestive heart failure leading to that, and the possibility of sickle cell leading to that. But all of that can be seen under the trigger, and what that can trigger inflammatory disease. So that is why we can put that under inflammatory disease. I hope that makes sense. And if fibrinogen is released during inflammation, what it then means is that another indication that there is an inflammation is high fibrinogen. Does that make sense, guys? Okay, so high fibrinogen can also be a strong indication that there is inflammation. So the answer is what? Inflammatory disease like temporal arthritis. So let's go back to the question since I've explained all of that. Which condition is associated with an elevated ESR? A, polycythemia? No. B, congestive heart failure? No. C, inflammatory disease like temporal arthritis? Yes. D, sickle cell disease? I wouldn't choose that. So the answer is C. I hope that makes sense. Please do let me know what you think about the video. Can I ask you to like, share, and subscribe? Make sure you subscribe. Make sure you subscribe and share the video to someone that may be preparing for American Society Pathology exam, or that is preparing for biomedical scientist interview exam, or anyone that you think that this can benefit. And of course, if you have experience and you think that there is something perhaps I have missed or I could explain better, or as the case may be, feel free to put it in the comment section. We all are learning, okay? All right, thank you so much, and I wish you all the best till I come back your way again. Bye-bye.